Well, good afternoon, everybody. It's Terry Walsh. This is my Wednesday update video for you on May 13th. I'm glad to see all of you. I just wanted to give you a quick update on a lot of the things that are going on. First of all, happy Mother's Day belatedly to all of the residents who are watching this who are mothers. And I wasn't able to see you perhaps on Sunday. I know Chesterfield, with the quarantine that's in place, wasn't really able to do much. And particularly not outside of your living quarters for Mother's Day. But I know that the staff there did as much as they possibly could to make you feel comfortable and welcome, and hopefully have as great a Mother's Day as possible. And at Sunset Hills, where there hasn't been a quarantine, had a spectacular event with a car parade, a drive-through parade. We had more than 200 cars on the campus at Sunset Hills, led by, I think, the entire Fenton Fire Department armada that led the parade across and around and through the entire campus. The whole thing took probably an hour or so, but there were antique cars and convertibles and grandkids and great-grandkids and everybody waving posters and balloons flying, and it was a great time. With the residents, as you know, were sitting on the sidewalk waving and blowing kisses. It was really a lot of fun. It was a spectacular event, and it was a lot of creativity, and I'd like to first thank the staff at Sunset Hills for doing that, and I hope that everybody enjoyed that time. I know of both campuses, the Mother's Day dinner meal was spectacular with prime rib and shrimp cocktail and all of the things that everybody had. So I hope that everybody enjoyed that as much as possible. We do know that the Chesterfield campus in independent living has been under quarantine for several days now. In fact, probably 12 days by the time, or 13 days now, by the time that you see this video. And 13 days is about to come to an end with the 14th day tomorrow morning, so that we know that for the Chesterfield campus, all of the independent living residents who've been under quarantine will be sprung from quarantine when you wake up first thing Thursday morning. That's great news. What has happened is the resident in independent living in Chesterfield who had tested positive for COVID-19 happened 2 weeks ago, Thursday, and so we battened down the hatches on campus, and I will personally thank all of you on the Chesterfield campus, independent living residents, for the cooperation and the understanding to be in quarantine for the last couple of weeks. And I know that it was hard to do. It wasn't easy to do. Nobody wanted to do it, but everybody did it, and you did a great job. And I want to thank everybody for that and for that understanding. On Sunset Hills, the work has been great. The residents have remained COVID-19 free for quite some time, actually since the beginning. We continue to do that. The residents, all of you, are paying attention to the protocols that we've asked you to pay attention to. Generally speaking, everybody continues to wear their masks. They continue to practice social distancing. We're scrubbing in and out of the buildings with the hand sanitizer, and we're maintaining our no contact policies. We still have no visitor policies on both campuses. We're going to maintain that for the foreseeable future. I'm not sure exactly when we will reduce that no visitor policy, but for now, senior living communities like ours don't necessarily fall directly under the St. Louis County rules or even the state of Missouri rules. We still fall under the guidelines of the CDC and the federal government for the Centers for Medicare and Medicaid Services for senior living communities and skilled nursing facilities. So we still have other requirements that we have to meet that are a little bit more stringent than what the state or even St. Louis County requires. So we still have things we have to do to maintain the safety of our residents on our campus. So we still have to maintain our rules, and that includes the no visitor policy that everyone's been living with. So we're going to continue doing that. We will be continuing to practice our mask wearing for our face masks. We have to continue our social distancing. We have to continue our no contact policy and our rules. We have to continue the hand sanitizer activity that everybody's been doing. But the good news is the quarantine in Chesterfield will be over tomorrow morning. Sometime today on Wednesday, if you haven't already, the Chesterfield residents will receive a letter at your door explaining the details of what's going to happen when the quarantine ends on Thursday. What activities you'll be able to participate in, how you will get your mail, how you will get your morning continental breakfast, and all of the other things that Chesterfield is setting up for you, so that when you're able to get out of your units, out of your apartments or your villas and be able to walk around, where you're going to be able to go, what you're going to be able to do to try to bring some more normalcy back into your life. We're very excited for that. The other thing that I wanted to report to you is not only has independent living on both campuses been COVID-19 free now for a while, and then the quarantine being ended tomorrow morning for Chesterfield, but the Village Care Center, the skilled nursing facility in Chesterfield, has been doing great work, tremendous work, particularly with the COVID Care Center that's inside the Village Care Center, the skilled nursing facility at Chesterfield. As of this update for you, we will be down to only 2 residents in the COVID Care Center, in the Chesterfield Care Center. The rest of them have graduated and moved back into the regular population. Our goal has been to get back to 0 COVID positive residents in the care center, and we are getting very, very close. We are, you've heard the phrase flatten the curve, and the care center in Chesterfield has, in fact, not only flattened the curve, but they've also started down the slope toward the end to 0 residents with COVID-19. There have been 16 residents within the care center in Chesterfield who have recovered from COVID-19. What a great story, what a great record for our care center staff in Chesterfield, and we want to thank them for all the work they've done. There were 9 residents in the care center who never had COVID-19 at all, who, based on some suspicions and maybe symptoms, we had them tested, and their tests all came back negative. There were other residents who never had symptoms at all and never got tested and never had COVID-19, but we had 9 who did get tested and never had it and came back negative. And we've had 16 fully recover, including our 107-year-old resident that everybody's heard about, in fact, everybody in the world has heard about, who turned 107 on the same day he graduated from the COVID Care Center within your Village Care Center, or the VCC, at Chesterfield. What a great testimony to the work of the staff in the care center there in Chesterfield. You should be very proud of what they're doing. So far, knock on wood, we've not had to activate the COVID support unit at Sunset Hills, and you remember that in the past I've talked to you about the potential to use our new memory care unit at Sunset Hills if we had had an independent living resident who had tested positive for COVID-19. That's where we would send them to recover in the lap of luxury in our memory care unit at Sunset Hills while they recovered, and we kind of keep them separated from the rest of the independent living population on either campus. Knock on wood, we have not had to do that. We've been blessed by our good Lord Jesus Christ to not have to do that. It still remains empty. It's not seen 1 resident in that unit because we haven't had to have it, and that's a great blessing that we've been bestowed, and we are very grateful for that. I do want to thank all of you for all of your participation and hard work to try to keep us COVID-19 free. Overall, we're doing very well, generally speaking. We haven't had any sales in the last couple of weeks because, as you know, our no visitor policy means that we can't bring prospective residents on the campus to look at apartments because we have a no visitor policy. So that has slowed down the sales on campus, as you would expect. We've also slowed down the number of residents we bring into our care centers, our skilled nursing facilities who've been in hospitals and have had procedures done, who need Medicare Part A or rehab, rehabilitation services for after a procedure. Because of all of the COVID scare, most of the skilled nursing facilities around town have suspended admitting those kinds of residents into their centers just to make sure that they remain COVID free. So we've done the same thing. So we've had a little bit of a dip in that particular business in order to protect us from bringing potentially COVID-19 onto the campus and also not spreading it to somebody else should they come here as well. But again, the biggest concern is to make sure we don't bring it onto the campus. Hopefully that will be ending soon. Hopefully we'll be able to open the new memory care unit at Sunset Hills the way we had originally planned, because we haven't needed it for COVID-19 positive independent living residents. And we pray that we'll be able to get back to normal operations very soon. We still have residents moving in to our new independent living buildings on both campuses. That's been a tremendous success. We're ahead of schedule in the move-in schedule that we planned in our 5-year expansion plan. And so they're doing very well. As you know, our new residents, and some of you are watching right now, our new residents in our new Devonshire building at Sunset Hills and the Rockhurst building in Chesterfield do self-quarantine for 14 days after they move in, just to make sure everything's okay. And they report their daily results of their temperatures and so on to our care navigators. And they're doing great. And over time, they continue to graduate. Every day, more graduate from their quarantine. And we get to see them on campus a little bit more in some of the open areas, public areas. And of course, now in Chesterfield, with the overall quarantine ending tomorrow, you'll be able to see more of them. But we still have more moving in virtually every day. We look forward to them coming out of their self-quarantine when all of that's over and welcoming them into the community as part of our family, and we can't wait for that to happen. I do not yet know when we will be able to go back into normal dining room activities. We still have restrictions upon us as a senior living community to not have communal dining on our campuses. So bringing the residents together into the dining rooms is still a work in progress in terms of how we're going to be able to do that. We are beginning to formulate plans for how we can still serve residents in the dining rooms, but keep everybody properly socially distanced from each other and still exercise our no contact policy. But we are not yet ready to do that. We want to do that. We're excited to do that. We know that's what you want to do because mealtime is a social event for all of you. And we want to get back to that as quickly as we can, but we're not quite ready yet. So I ask your patience with that. Meals will still be delivered to your units as they are now. And I understand that the food is great. And I know that everybody's been enjoying that. And that's going to have to continue for a little while longer. Again, residents in Chesterfield will receive a letter before the end of the day today, on Wednesday, about what's going to happen when the quarantine is lifted, which is when you wake up tomorrow morning, Thursday morning, and what you'll be able to do and still not be able to do, and all of the other procedures that everybody on both campuses still needs to practice, and that's the mask wearing and the no contact policy again, and the social distancing, and then of course the hand sanitizer. We've got to continue those practices. It's been working for us, and we've got to do that. Now, there have been some questions about some phone calls that we put out on the weekend advising you about some of the procedures if you do leave the campus. And I know that there's been some confusion, but actually the policy has not changed. But we know that over the Mother's Day weekend, a lot of residents were tempted to go visit their families in their families' homes. Some of you did. Some of you were able to resist. But whenever something like that happens, when a resident goes to visit and spend time in someone else's home or in another place, there is a high risk for contracting the coronavirus and bringing it back to the campus. We do not want the coronavirus on our campus. We've been fighting this off for 2 months now. We've been very successful in doing that, and we don't want to ruin it now, and we certainly don't want to have to impose another quarantine on the campus in Chesterfield and not in Sunset Hills either. You are allowed, obviously, to go to essential visits, essential trips to the doctor's office. We are not inhibiting anybody from going to a doctor's visit as long as you maintain all of those protocols that I just listed, with the face mask, the hand sanitation, the no contact policy, obviously, except with your physician, and the social distancing. Not every doctor's office is very good at that because some of the waiting rooms have a lot of people waiting in them. You have to be the person taking control of your situation in reducing your risk. Trips to the grocery store are okay. I know, particularly in Chesterfield, you've been chomping at the bit to get out of the building and go to the grocery store and restock some of your provisions. I get that. And even though we have ways on the campus for you to get groceries delivered directly to you by calling the concierge or the Schnook store directly, you can get those delivered directly to you, but I know some of you still want to do it yourself. And that's okay in the non-quarantine world, but again, you have to be very careful about what you're doing. You have to follow the protocols because we do not want you to bring COVID-19 back to the campus. And I know, again, and I've said this before and I said it last week, 90% of you get it. 90% of you understand what I'm saying and what I'm asking. 5% of you will make a mistake and forget something unintentionally. But you have to try to ask, and if you don't know, call somebody within the building and ask. And 5% of you don't get it. 5% of you watching me right now do not understand what I'm saying or what I'm trying to get you to do. What I ask you to do is ask somebody. Ask somebody what we want you to do, what we need you to do to try to protect the campus. What I'm most concerned about is when you go to visit family or friends or anyone, or go to a restaurant or go to some other place where you have any extended period of time at all in close proximity to other people. And this includes with your loving family in their own living room, because nobody knows if somebody has it. Nobody knows. We had a case on one of the campuses last week where a resident's daughter came from a long way away to help them go to an early physician's appointment the next morning, and we found out the next morning that that daughter ended up having a fever and a sore throat, which are symptoms of COVID-19. Now, they reported it immediately, and then they left the campus, but for 2 days before we were able to understand what the test result was going to be, nobody knew if they had just brought COVID-19 to the campus. Now, thanks to the good Lord, we did not bring it on campus. That person tested negative. Thank you, Jesus, that happened. But it could have gone the other way. And the problem is nobody knows it until it happens. We cannot anticipate having it. So that's why it's a very strong risk for you to visit friends and family, even friends and family, for extended periods of time in their own home or anywhere else where you're in close proximity, because you can bring it back. And you know, it only takes one match to light an entire forest fire. And when it comes onto a campus where we have residents living around each other in close proximity, that becomes a forest fire very quickly. So essential visits are fine. You got to go to the doctor's office. We don't want to stop you from going to the doctor's office. Just be careful. You need to or have to go to the grocery store or to the drugstore, and that's fine. Those are essential visits. We understand that. You know what you need to do to be safe and careful. Non-essential visits, and I know everybody's been in quarantine and every visit with the family is essential. Some are less essential than others, and you know what I'm saying here. Those extended periods of time in close proximity with other people who we don't know and they don't know and you don't know if they might have the COVID-19 virus, that is a high risk. We ask you to not do that yet. Just because quarantine is lifted, just because the stay-at-home order for the county is lifted, the coronavirus knows nothing about that. It doesn't read the newspapers, it doesn't watch the news. The coronavirus is still out there having a great old time. And I have to ask you to be careful about that and don't bring the coronavirus back to the campus. The problem is you don't know if you brought it until it's already there and it's too late. And the match is already lit for the forest fire. So I really ask you, beg you to be very careful about that. If you insist on doing that, we're not a prison. We cannot lock you onto the campus, and we don't have any intention of doing that. But we strongly discourage that sort of a visit or activity. But if you insist on doing that, you can do that. I cannot stop you from doing that. What I do ask you to do is let someone know you're going at the front desk before you leave. Let someone know when you come back. And if you did go visit anyone for an extended period of time, meaning like at any time at all, then I need you to be able to go right back to your apartment or to your villa and stay there, kind of self-quarantine until you've had the opportunity to talk to either Michelle Dane at Chesterfield or Amy Meek at Sunset Hills and have an opportunity to talk with them the next time they're in the office, the next business day, and let them help you decide what your course of action needs to be. So if you've been off campus against our encouragement to not do that, and you visit with friends and family in their homes or somewhere else in close proximity, then I need you to help us by voluntarily self-quarantining in your apartment until you're able to talk to Michelle Dane in Chesterfield or Amy Meek in Sunset Hills about what you have done so that they can help decide whether you need to continue quarantining or not. I need to ask you to do that immediately upon return, is to go to your apartment and voluntarily self-quarantine until you have a chance to talk with them about your situation. Everybody will have a different situation. That's what I ask you to do. I hope there's no confusion about that. If you go to the doctor's office, okay, follow all of the procedures that we've already outlined. Come back and be safe. If you have any symptoms on your own, please report those immediately to your care navigator. If you go to the grocery store, that's okay. You're not spending prolonged contact with anybody at the grocery store. Follow all the procedures. But if you go visit people, or you're sitting in church with a bunch of people shoulder to shoulder and you have any prolonged contact at all with anybody, including riding in your adult children's car with everybody in the family, that is extended prolonged contact. I need you to then self-shelter in your apartments when you return until you've had a chance to talk to the care navigator. I know I've repeated that 5 times now on this video. 90% of you get it, 5% of you think you get it, and 5% of you don't understand what I'm saying. So please ask somebody if you don't understand what I'm saying. You're doing a great job. The care center on both campuses are doing a great job protecting the residents. The staff on both campuses are doing a fantastic job trying to be innovative with everything that they're doing to try to keep you entertained, to try to take care of all of your needs, to serve you. and to provide good food and some electronic entertainment. We want to thank them for all of that. It's been a big exercise for everybody, but we will have to continue to do this until this thing is behind us. I wish I could tell you today when that's going to be, but I do not know. But it is our responsibility to do everything we can to keep you safe, and that's what we're going to continue to do. I hope that you have a great day today. I congratulate you if you're a Chesterfield independent living resident. I congratulate you on a successful quarantine. And I hope that you enjoy your ability to get out and walk around tomorrow. When you wake up, please be on the lookout for your letter today. If you've not gotten it already, you will, about what you're going to be able to do or not do and what some of the guidance is for the end of quarantine for you. But otherwise, I hope you have a great day. I still do my morning visits with you very quickly on Channel 900 for those of you that wake up in time to do that. I also place my morale calls to a lot of the Chesterfield residents. That will probably end now with quarantine, but I've really been enjoying that. For those of you watching that I've talked to on the phone, those are actually kind of enjoyable calls for me, and I really have fun doing that. And I'm going to kind of miss doing that, but overall, I've really enjoyed talking with those of you that I've talked with. But I hope everybody continues to have a great time as much as you can. We're going to do everything we can to begin trying to bring people back together, but I can't tell you the day that that's going to happen. But we are trying to formulate our plan so that we can do that in a very safe manner and not light the forest fire on our campuses. We do not want to do that for you or for the staff or for anyone else. I hope you have a great day today. I love talking to you. If you have any questions, let us know. Otherwise, I will see you around the campus. I want to farewell very quickly Mike Hambley. After this week and after Friday, Mike Hambley, the executive director in Chesterfield, will no longer be with us. His last day on the campus in Chesterfield will be Friday before he leaves and packs his household goods and moves to Wichita, Kansas. So I want to give a shout out really to Mike Hambley. The residents in Chesterfield will be off quarantine Thursday and Friday. I hope you have an opportunity to seek Mike out and farewell him and say goodbye. Don't give him a hug. Don't give him a handshake. Don't give him a pat on the back because we have the no contact policy. But from more than 6 feet away, you can certainly wave or maybe even blow him a kiss if that's what you want to do. But we're going to miss Mike. And then you will begin seeing Carmen Franzak on a very frequent and daily basis on the campus there in Chesterfield as the interim executive director. And if you don't know who she is, you will very soon. She's doing a great job. She has been shadowing Mike for the last couple of weeks, learning what he does and learning much about you. And she's going to be a great interim executive director for the Chesterfield campus. I hope you get to know her. And I hope that you give her the respect that you give everybody who helps keep you safe and to run the campus for you. I look forward to seeing you. I do get back and forth to the campus. I'm not going anywhere. So I am going to be around for sure on both campuses. Hopefully we'll be able to open your new clubhouse in Chesterfield soon. We've got construction going on everywhere, and everything is still moving at full steam. And we hope to be able to be in all the rest of the new buildings before the year's out. Again, it's good to see you. I love talking to you and giving you the update. If you have any questions, please let us know. But otherwise, have a great rest of your day. Goodbye now.